Hello everyone, today I will introduce you my paper, which is called Analysis of the Possibility of Effectiveness, the Therapeutic Techniques for Diabetics in the Treatment of Heart Failure. First, let me introduce myself. I'm Huang Qingyi from Jiangsu Province, China, which is near Shanghai. Now I'm a senior student at the Guangdong Technion-Israel Institute of Technology at present. My major is biology and food technology. In the following period, I will introduce my research. Thank you for taking the time to listen in the next moment. The aim of this research-based study is to investigate the following three parts: the relationship between the development of heart failure and T2DM, analysis of the treatment of type 2 diabetics, and exploration of whether it can have an effect on the treatment of heart failure. Exploration of a new approach to treating HF, reduce the risk of HF caused by T2DM through the treatment of T2DM to break through the treatment of HF. Now you may ask, how did I get the idea to focus on this thing? Due to my grandfather. My grandfather has been suffering from type 2 diabetes for around 10 years, and also he had a poor heart and high blood pressure because of unhealthy diet. He takes several medications and insulin injections every day. This is especially hard and painful for the elderly. So I'm quite familiar with these types of diseases and would like to learn more about them. And this is my opportunity to choose to study this topic. The meaning of the research is obviously very valuable. We would like to explore a new approach to treating HF and want to break through the treatment of HF through the treatment of T2DM. With this new method, there are chances to reduce the risk of HF caused by T2DM. Next, I would like to show you some data about T2DM and HF to give you a more intuitive understanding of how serious they are, how common it is in life, and how well the scope is. The bar chart shows the global population and the prediction of type 2 diabetics. The population will grow gradually as the years go by worldwide, and T2DM accounts for 90% to 95% of all diabetics mellitus cases. Type 2 diabetics mellitus is a global epidemic and is expected to affect over 592 million people worldwide by 2035, a dramatic increase from 382 million people with diabetes mellitus in 2013. In the US alone, there are over 30 million adults who are diagnosed with DM, meaning about 1 in 10 people have diabetes, and the number of potential diabetics is even higher. The cost for the whole country to deal with diabetics is enormous. As for heart failure, today more than 6 million Americans are living with HF, and the number is predicted to rise by 46% over the next 15 years. That means nearly 8 million Americans are estimated to be living with HF by 2030. Heart failure is the leading cause of hospitalization in people older than 65. Both diabetics, mellitus, and HF are within the list of top 10 global causes of death, becoming a veritable world's biggest killer. To carry on the whole paper smoothly, we mainly use the two types of research methods: literature analysis to study the relationship between the development of heart failure and the T2DM, and survey method to see if the treatment of T2DM can alleviate heart failure. The research content will start from the introduction of T2DM and heart failure. So what is heart failure? In short, heart failure simply means the heart muscle isn't pumping blood as well as it should. It can be caused by many different heart conditions and tend to get worse over time. It does not mean your heart has stopped working or that you are having a heart attack. The most common cause of heart failure is congestive heart failure. This means fluid is building up in the body because the heart isn't pumping properly. What is type 2 diabetics? Type 2 diabetics develops when the body does not use insulin efficiently and gradually loses the ability to make enough insulin. Insulin is a hormone that controls the amount of glucose in the blood. Insulin helps the glucose produced by the digestion of carbohydrates move from the blood into the body cell where it can be used for energy. In type 2 diabetics, the body cell does not respond effectively to insulin. This is known as insulin resistance. It causes glucose to stay in the blood, leading to a higher than normal level of glucose in the blood, known as hyperglycemia. Then we can have a simple knowledge of possible links between HF and T2DM. From the aspect of correlation between their risk factors, the figure demonstrated the risk factors for type 2 diabetics mellitus and congestive heart failure. The development of heart failure in patients with type 2 diabetics mellitus is largely attributable to concomitant hypertension and coronary artery disease. Then we will look through the correlative mechanisms to prove that there are relations between T2DM and HF. T2DM can cause HF. Schematic diagram shows pathophysiological mechanisms of cardiomyopathy in type 2 diabetics. Fatty acids are preferentially metabolized to ATP, sustaining muscle contraction. During progression to severe stages of cardiomyopathy, both increased FA metabolism and accumulated ceramides contribute to inflammation and fibrosis, leading to cardiac stiffness and reduced contractility. The first part of the main body of the article is about introduction to heart failure related to T2DM. The figure shows the pathophysiology of heart failure in diabetics mellitus. The hyperglycemia, insulin resistance, and hyperinsulinemia that often accompany diabetics mellitus trigger a cascade of deleterious effects that contribute to the development of heart failure in diabetics mellitus. DM commonly causes structural heart disease and HF, while myocardial ischemia or infection. Hyperglycemia and hyperinsulinemia accelerate atherosclerosis, while vascular smooth muscle cell proliferation and inflammation. Ventricular remodeling is the main pathophysiological change of chronic HF, and its formation process is complex. Various mechanisms such as hyperglycemia, oxidative stress, inflammation, apoptosis, or fibrosis can lead to ventricular remodeling. These pathological changes, closely related to T2DM, may lead to the occurrence of T2DM-related HF. T2DM is characterized by hyperglycemia and oxidative stress. Oxidative stress is mainly caused by the imbalance of increased reactive oxygen species production or decreased antioxidant defensibility, both of which can lead to T2DM cardiomyopathy. At the same time, oxidative stress can also cause myocardial inflammation related to heart injury, driven by hyperglycemia and oxidative stress. The formation of advanced glycation end products in T2DM patients is greatly accelerated. AGE can alter vascular wall homeostasis through a variety of mechanisms, leading to chronic vascular inflammation that leads to rapidly progressive T2DM-related atherosclerosis, resulting in impaired myocardial blood supply. The increase of AGEs may also change structural proteins, leading to the cross-linking of collagen molecules and weaken the degradation ability of collagen, resulting in increased fibrosis, increased myocardial hardness, and decreased cardiac relaxation, which increase the risk of heart failure. The characteristics of type 2 diabetes mellitus-related ventricular remodeling are mainly these 5 parts: left ventricular hypertrophy, inflammation, increased extracellular matrix production, impaired cardiac metabolism, and myocardial cell apoptosis. Then we will move on to talk about the second part of the main body, the high risk of developing heart failure for people with type 2 diabetics. The figure displayed the prevalence and annual incidence rates of CHF per 1,000 people. CHF was approximately 2 to 8 times more prevalent in subjects with diabetics than in the age and sex-matched control group, and incidence of CHF increased dramatically with age in both groups. Annual incidence of CHF was also age-related. Subjects with diabetics were 2 to 5 times more likely to develop CHF than subjects in the age and sex-matched control group. A marker for renal function assessment is estimated glomerular filtration rate. Reduction in eGFR has been shown to be both highly prevalent and longitudinally predictive of the development of HF in people with T1D and T2D, and eGFR reductions are a strong predictor of unfavorable outcomes in HF. Patients experiencing worsening kidney function had a higher risk of subsequent cardiovascular events, including the composite of cardiovascular death or HHF and the cardiovascular death, with around 2.5-fold higher risk with an eGFR drop greater than 40% from baseline. We can see this intuitively from the two figures. The last part of the main body of the article will focus on introduction to heart failure related to T2DM. The observation that blood glucose lowering may not be sufficient to prevent increased hospitalization and mortality from HF reinforce the possibility that additional factors beyond the glycemia may contribute to the increased HF risk in diabetics mellitus, or that independent mechanisms might exist linking anti-hyperglycemic therapies and left ventricle remodeling. Beyond the structural and functional changes that occur with diabetic cardiomyopathy, a complex underlying and interrelated pathophysiology exists and may contribute to HF in the context of diabetics mellitus, some of which may be amenable to pharmacological therapy. These pathways are shown in the figure below, pathways of complex underlying and interrelated pathophysiology contributing to HF in the context of diabetics mellitus. Current anti-hyperglycemic therapies and potential therapeutic targets that could modulate diabetics mellitus associated heart failure. Diabetics mellitus is a multi-organ disease state characterized by hyperglycemia and dyslipidemia. Current commonly used therapies may achieve normal glycemia, but they have variable effects on heart failure risk and outcomes. Alternative targets that could be amenable to pharmacological treatment and that may increase the risk of heart failure in diabetics mellitus are summarized. Next, we will mainly discuss about one type of treatment drug, SGLT2I inhibitor. Here presented is SGLT2 inhibitor mechanisms. As blood sugar lowering agent, SGLT2 inhibitor work by inhibiting SGLT2 transport into egg white located in proximal renal tubule, reduce renal tubular reabsorption of filtered glucose and sodium, and then excrete glucose through urine, resulting in natriuresis. At the same time, afferent arterial constriction was promoted, and sodium and chloride ions were increased to induce dense spots constriction, and the feedback mechanisms of renal tubules was restored and regulated, thus achieving the effect of hyperglycemia due to their simultaneous reduction of glomerular blood pressure, proteinuria, and renal hyperfiltration rate. They may have a role in reducing or improving renal disease in diabetics. Such mechanisms represent a key issue in understanding why SGLT2 inhibitors are so effective in decreasing heart failure exacerbation in the largest spectrum of cardiovascular conditions, including diabetic and non-diabetic subjects with and without chronic kidney disease, HF patients with reduced or preserved injection fraction. SGLT2 is a transport protein found in the proximal convoluted tubule and is responsible for reabsorption of greater than 90% of the glucose filtered at the glomerulus. SGLT2I block filtered glucose reabsorption, leading to increased glycosuria. This effect results in decreased plasma glucose, body mass, visceral fat, and oxidative stress. The cardiovascular and renal benefits derived from SGLT2I are not solely due to glycemic control, but also from an array of mechanisms leading to reduced plasma volume, systemic blood pressure, neurohormonal stimulation, and improved natriuresis, vascular function, metabolic efficiency, and changes in tissue sodium handling. In the end, I have a summary. The results of the paper do indicate that treatment of type 2 diabetics slowed the symptoms of heart failure and that treatment of type 2 diabetics did have some effects on the treatment of heart failure. Treating diabetics with heart failure-related therapies can also partially curb the likelihood of heart failure risk in diabetics. In conclusion, it is of great significance to use type 2 diabetics for the treatment of heart failure, and its effectiveness also provides ideas and feasible references for the treatment of other diseases. That's all. Thank you for listening. If you have any questions about this paper, you are welcome to discuss.